Welcome to Chapter 4, Medical Terminology. This is a very important chapter. This gives you the foundation of many of the things that you will see as a pharmacy technician. So what are some of the learning objectives? So by the end of this particular chapter and completion of studying, you should be able to explain the common nomenclature system used in medical science terminology. You should be familiar with the medical science terminology associated with major body organ systems. You should be able to recognize how the common nomenclature system is used in naming drug classes, and then give a appreciation of the complexity of medical abbreviations. So by the end of this particular chapter, you should be able to have a understanding of how nomenclature fits in with understanding biology and human anatomy. Let's think about thinking it through. A patient comes to the pharmacy with a prescription for atorvastatin and tells you that the doctor changed her prescription because she had developed rhabdomyolysis while taking simvastatin. You want to make a note of this information in the patient's profile and glance through the other information to find the appropriate place to put the new information. In the patient's medical history, you see that she has hyperlipidemia, which is why the simvastatin was prescribed. But the patient also has hyperglycemia, hypertension, COPD, and GERD, and takes an anticoagulant for atrial fibrillation and an antidepressant. The patient was recently discharged from the hospital where she was treated for community-acquired pneumonia. As you read this chapter, see if you can identify the various parts of medical terms, root words, prefix, suffix in the above scenario, and then what each whole word mean. Also consider the following. 1. What are the parts of the medical terminology combined? 2. Using medical abbreviation can save space on written documentation and can make communication with other professionals faster. What is the major drawback to using abbreviations? And 3. The system of learning medical terms associated with an organ is often used to teach medical terminology. What is an advantage of that learning approach? So these are 3 questions that you should be able to figure out by the time we finish this particular chapter. Okay. Again, we finished taking a look at thinking it through. And make sure that you understand the root word, the prefix and suffix, and the combining vowel in order to have a good understanding of what the words mean. So some of the things that we'll talk about during this particular chapter, we will look overall on terminology, touch base on prefixes and suffixes, look at the different organ system terminology, such as those associated with the cardiovascular, endocrine, gastrointestinal, integumentary, lymph and blood, muscular, nervous, skeletal, female reproductive, male reproductive, respiratory, urinary, and senses systems. When we talk about the senses, there are 5 senses. Here we will speak specifically about hearing and sight. We also will look into drug classifications, medical abbreviation, and then I would suggest that you review the information that's found not only in your textbook, but also in the workbook. Okay, so medical dictionaries contain thousands, tens of thousands of words, I would say, that is used in both medicine and pharmacy. Medical science terminology is made up of a number of small root words, and then you have the fixture of suffixes and prefixes that are attached to those root words. Many times you have what's called combination vowel that will connect the prefix, the root word, and or of the suffix. So certain definitions that you should be familiar with is combining vowel, usually the letter O, and we'll talk about that again. And this is what is used to connect the prefix, root word, or suffix part of the term. Prefix, a modifying component of the term, beginning at the located at the beginning of the term. They have the root word, the base component of the term, which gives it meaning and may be modified by other components. And those other components include the combining vowel, the prefix, and the suffix. And then the suffix, a modifying component of a term located at the end of the term. And all of these we are going to cover in detail. Okay, so when we talk about terminology, we're talking about having the root word, the suffix, which is the term that goes after the root word, prefix, a term that goes before the root word, and the connecting vowel, which connects either the suffix, prefix, to the root word. So again, the root word is the foundation of medical science terminology and can identify or can immediately identify a disease or what part of the body that particular term is related to. Okay, if you go ahead to YouTube and put in medical terminology, introduction to medical terminology, Google it. There are several videos that can be helpful that give you an overview of the basic medical terminology. So again, when we're talking medical terminology, we're talking about the words, the dynamic combination of terminology associated with root words, prefix, suffix, and combining vowel. Let's take a look at this particular example here, periodontic. We have several different parts of a word that can put together and lead to a particular meaning. For example, you have peri, which is a prefix which means around. You have o, which is a combining vowel. You have dant, which is the root word meaning teeth. And then here we have ik, which is a suffix meaning pertaining to. So what is this? Pertaining to a particular situation around the teeth. Okay, so periodontic. And many of medical terms is based either in Greek or Latin words. Greek words usually seen in terms that involve diagnosis and surgery, and Latin words that's associated with anatomy. In relationship to Western medicine, we talked about two very prominent physicians. One, Hippocrates, do no harm, the Hippocratic Oath, do no harm, which was Greek, and some people feel the father of Westernized medicine. And then you have Galen, which was a Roman physician, and those two had a very prominent role in Westernized medicine that we see today. And let's look at some of the examples that we have in relationship to medical terminology. And you should be familiar with these. These are very general. So you have card, which means heart, cyst, which means bladder, gastr, which means stomach, hemat, blood, hepat, liver, my, muscle, pector, chest, nerve, pneumon, lung, ocule, eye, derma, skin, vein, mast, breast, ost, bone, nerve, kidney, and ear. Okay? And as we go forward, we'll put that together. So, for example, when we talk about carditis, bladder cystitis, stomach gastritis, blood hematology, liver hepatitis, muscle myocardial, chest pectoris, nerve neurology, lung pneumonia, oculomotor, dermatitis, venitis, mastectomy, osteoporosis, nephritis, and aortic. Those are just some of the words that can be associated with these particular root words. And we're going to look at more. Let's look at some of the prefixes. Again, we defined prefixes before, and we're going to do it in a little bit more details. And these are added before the root word or suffix to alter its meaning. For example, when we talk about hypertension, we're talking about high blood pressure. And I believe that was one of the questions on your quiz for chapter 4. And hyper means excessive. Anorexia, without appetite. Anorexia is a disease and with the body image in which individuals lose a lot of weight, and can lead to even death, because the individual perceives that they are overweight when they are not. So you have an, which means without appetite. An is equal to without. Postpartum, after birth. And dysphagia, difficulty in speaking this. So these are just examples of words that are used to add meaning and come before the root word. Hyper, root word is tension, hypertension. Anorexia, orexia is a root word. Partum, postpartum, that's after birth. Partum is a root word. Here you have this, you have face, where this means painful, and ia is a suffix. So here in dysphagia, you have both a prefix, a root word, and a suffix. Okay, let's look at suffix. And these are added at the end of the root word or a combining vowel to modify the meaning of that particular terminology. For example, all. All means pertaining to. So you have den pao, pertaining to teeth. Itis, the one that you will see over and over again, dealing with inflammation. Itis, inflammation. So gastritis is inflammation of the stomach. Then you have oma. Oma is tumor, like melanoma. And melon is overproduced in, melanin is a natural pigment of the skin, and the cells that produce melanin can sometimes become tumorous. You see this in many times lighter skin individuals. Okay, and then you have the combining vowel. Sometimes a combining vowel is added to make the pronunciation of the word easier. O is the most common of the combining vowel, so sometimes a combining vowel is added to have words connect together, and we'll continue our discussion.